So here's what happened at my non-literate Lyme doctor visit. You guys know what happens there, you know the frustration, and here are my recaps from afterwards. So here you go. You can ask me the questions.
Well, I don't know how I can ask you the questions when I'm in the house.
I can hold it. I can hold it.
Kind of, yes.
Hi. 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 How are you?
So good right now.
Hi.
Yes, she's doing a lot better when we left the house.
Yeah.
And I think the car ride here just kind of made her, set her off. I don't know which one's
So I don't know when we have seen her. we don't have,
You know,
we haven't seen her, right? It's not even,
you
we
have?
saw her 8 years ago.
Okay.
And not even then. It was 2000, the last appointment, possibly in 2000, so it's like a new patient, right?
Yeah.
Like 2008 or something like that.
Yeah, what happened was, we switched over to Kaiser.
Okay.
She was on her Kaiser insurance for a few
Okay.
years, and then the last over a year and a half, she's been in Phoenix, but she's been seeing doctors in Phoenix until she just recently came back here.
Okay.
And yesterday, well, actually the night before, she wasn't feeling real good. And yesterday, she didn't eat anything all day because she felt nauseous, and she tried, cook food, and she couldn't eat it. And,
Is she on wheelchair
no,
basically?
just
when it gets,
she got here.
yes.
She hasn't had to use a wheelchair for a while now, and just when she got here, it just something set her off. The car ride or something really set her off. So
And that means what? She gets weak.
she's weak. I think, Kimberly, am I right? Do you feel like?
I'm sorry, I'm not looking at you because
No,
you're
it's
kind
fine.
of, it's hard for me to,
No, it's okay.
if we can turn you this way, let me get
Yeah,
my
that's fine.
stool, then I can sit here and talk to you a little
Okay.
bit better, right? Okay, I'm gonna
I
turn you around. Okay.
I just get really weak, and I don't feel like I'm totally here.
Okay.
She's foggy.
This
Yeah.
isn't like a normal reaction for me.
Okay.
Yeah, this is unusual that this happened right now. I didn't expect this today.
Yeah, this isn't, I don't remember
Okay.
this happening.
Yesterday, she had a little bit of this, kind of off and on. A little bit of this kind of, she said, my brain
This
just
was
isn't-
like all day yesterday, but like I just kept sleeping. I was so tired, and I slept like hours yesterday, and then
Okay.
I slept through the night, and that isn't common.
Yeah, and then you had a sore throat, so it's possible something viral is kind of triggering some of this effect for you, right?
Are you okay with her filming this? She does some blogs on.
Oh, sure, you can do it, that's fine. So I just want to pay attention to what she's saying, though, so we focus on that rather than. So I don't really know you at all now from your history. So we need to kind of understand all what's been happening to you in the past, right? And I don't know if I'll have the time to go over it, all of it.
Mostly like what's going on now is like acute. It's separate from like the typical Lyme stuff that's going on, and that's what I'm worried about because I had such bad pain in my head yesterday. Like I couldn't, every time I would stand up, I would feel like I was gonna throw up, and I couldn't eat anything. I couldn't drink water, and I'm just like, I'm really out of it. I feel like I'm like floating and like I'm really having trouble.
Okay, so I don't really know much about this kind of level of Lyme disease, and so we have to find the right person, because especially if you're linking it to Lyme and you think this is related.
I don't think it is.
And so we do need to, because it's kind of happening suddenly and all, we can certainly check your labs and all to see what your numbers are. Now, were you under any treatment from somebody up there,
No,
or
I'm not
have you been on
anything
with
right
any
now.
kind of a doctor out there to who's treating you for Lyme?
Here,
type
let me,
of-
and she's having trouble. Let me just
Yeah.
interject. She was on a treatment program in Phoenix for Lyme disease.
Okay.
And that pretty much finished. She completed that treatment program. So she doesn't have a general practitioner established here.
So her Lyme, the doctor that was treating her in Phoenix was at the clinic. So she needs a new general practitioner. And we were thinking that her problem that she's been having just recently in the last couple days possibly was ear related, because she does tend to get wax buildup in her ears. And she also, second last time she had her ears flushed, I think, they it looked like candida. It was actually not wax, it was yeast that they flushed out. So, and she gets like this and this has happened for years, that she gets.
So have you seen anybody here who was a Lyme because I don't really know where to send you.
She is seeing someone. She is seeing someone.
Now here
yes.
Locally? Who's that person, do you know?
Well, she's in San Rafael. So we are seeing a Lyme specialist, but she also needs a physician that is outside of that realm that she can get to.
Because the
thing
is, that's fine. That's totally fine, but it's also because I don't know how we will be able to kind of completely separate what's related to her Lyme issues versus this, but for sure I think I'm just going to do a quick exam as well. And then do you think you need labs done? Because have you had them recently done, or this specialist, has she done any blood work for you?
Not like an overall like CBC or like any like.
None of that has been.
She just had her testosterone checked levels, but that's.
It's like basically it's just I think I have a sinus infection and an ear infection, and that's what I think is going on, and it's causing me to like. And I have like some stomach pains and stuff, and those are all like recent things.
Okay.
Yeah.
Okay.
So I think what happens with Kimberly is what would normally be for the average person a somewhat, irritating, situation, maybe painful. For her, because she's so compromised, it becomes debilitating. Yeah. So her symptoms just become more severe than I think what the average person would get.
Sure. Okay, well, let's check it out and then see what we can do. So.
I'm gonna stop filming, Kimberly.
And then your vital signs.
Waiting for my mom to come get me. Still in the wheelchair, feeling a little better, but having a hard time. I'm gonna go home and try to eat. It's been a challenging last couple days. I got really sick yesterday afternoon, so we'll see how things go the rest of the day. Office visit kind of went how I expected it to go. Not really much came out of it, but they're gonna send me to the ear, nose, throat doctor, and so we'll see if anything shows up there. Really nauseous at the moment again. Just want to go home and lay down. I pretty much slept like all yesterday, and then even slept through the night, and it was like the only way to get the pain in my head to go away. I had such severe headache and just like so much pain in my sinuses and all down my face and like into my jaw and my ears. It was really intense. I'm used to pretty bad pain, but that was really intense. I couldn't stand up without like throwing up. It was really bad. So hopefully today goes better, and hopefully I can get some food down. I couldn't even drink water yesterday, so I'm a little more perky, but they had to give me a wheelchair because like I couldn't even get up. I couldn't barely see. Like all my peripheral vision was gone. I had total tunnel vision. It was pretty bad. So yeah, we'll see how things go the rest of the day. Here's my mom. It's so hot out here. I should have taken my sweatshirt off before he got in. Yeah. Yeah. Alright. Oh, I stuck to the chair.
Oh.
Keep pushing it.
I need to turn the car back on. I didn't want to leave it just in case I...
Yeah, I can't turn it on from... I'm going to take it off right now. Yes, please. When I first went into the appointment, I seriously was like starting to get so dizzy. I thought I was going to pass out. I thought I was going to have a seizure. I was just trying to do anything to I just laid down on a bench with my head covered. There were a bunch of people in the waiting room. I was like, I don't even care. You get to that point where you feel so sick that it doesn't even matter. I just want to go home and be in bed, and that's it. Alright, so now we're gonna drive home and hopefully I'll be able to eat something. I cooked 2 meals and I haven't eaten any of them because I was so sick yesterday, so I have some zucchini and avocado. Made it home and we tried going to get my blood work done, but they were closed for lunch, so it was a difficult walk there and back for nothing at that moment. I was able to eat, so that's good. I'm feeling a little nauseous and my stomach is really hurting right under my rib cage here, and that's where I keep getting pains. I thought it was my liver for a long time, but now I'm wondering if it's this thing called Mekels Diverticulitis, and that's I have a lot of the symptoms. My mom was kind of researching it, and she was like, it could be an ulcer in your lower stomach or the part of your stomach that goes into your small intestine. So I don't know. I'm just really tired, and I keep getting dizzy and lightheaded when I stand up, and so I'm just taking it easy today and just kind of laying on the couch, probably take a nap again. The office visit just kind of went how a typical non-Lyme literate doctor visit goes, and I don't really like going to pharmaceutical doctors I call them, because they just prescribe medicine. It's oh, she's take some Pepto-Bismol, I can give you some antacids. It's and it didn't even say that I had acid reflux. Why are you giving me antacids? I don't have that. And it just didn't make any sense, and she wasn't concerned about my sinuses at all. Barely looked into my ears, which I'm glad that my ears are okay at the moment, but she's concerned about doing an ear flush because she doesn't want to make things worse if there is something going on, so she wants me to see a specialist, and who knows how long it'll take to get into a specialist, and that's another appointment, and so it's just kind of the life of a Limey. But yeah, so I will catch up with you guys later. Bye. Good morning. Just woke up, and recapping from yesterday, I had a difficult last two days, and yesterday was another one that was taxing on my body, and then ended on a personally, emotionally taxing note. I'm still waking up. Yesterday, I started feeling a little bit better, just progressively started getting better. I was able to eat, which I think I said yesterday, and get up and walk around, and I was still feeling a little bit dizzy, but nothing like I was when I was at the doctor or the day before. 2 days ago was insane. It was just kind of a rough last couple days, but made it through, and hopefully it starts to get better. I really need to get back on the ketotafin. I'm just waiting for it to come in, and that's the mast cell deactivating stuff. That really was helping. I've definitely been feeling potsy and having other symptoms that are all related to the ketotafin stuff, so yeah, that should be making a difference soon. So I will update you guys later, and I think that's all I had to say. I don't know. I slept last night, but I could tell like I was herxing because I was taking the cold and flu medication, and the cold and flu medication is viral, bacterial, and fungal, and so it kind of just was killing like everything in my system. Plus it kills parasites too. A lot of the stuff that's in it is the natural stuff that kills parasites. It's like a natural tincture. And I remember off the top of my head that garlic is one of the main ingredients in it, and I believe it has onion in it too, which are all things that I've been cutting out because it's all got sulfur in it. So I've been taking like extra molybdenum. Molybdenum is a supplement that breaks down sulfur. So that's what's been going on. And I definitely was herxing last night. So it was like clammy and having hot flashes and achy, restless leg all over, so that was fun. But hopefully it's killing some other bugs in the meantime. I'm looking forward to my soda machines coming, which are not the drinking machines, they are the machines for pulsing. And yeah, so that should help with lots of aches and pains and stuff on top of other things. So yeah, that's what's up. No, I'll talk to you guys later. All right. Bye.